best friend? Okay. 1, a 2, a 3, a 4.
Okay, 4.
Hornitos.
4.
Alright. Loops. 2 loops. 1 and a 2.
Okay.
Thank you for keeping me sane. And my Bowie tip. Bowie 1 Kenobi.
Okay. What happened? Oh,
Okay.
okay, I think we got everything, hey?
Alright. Yes, I think we do. We are counted. Alright.
Do you want drugs? That's a little question. Do you want to do drugs now?
Yeah, please. So what I'm doing is I'm taking a couple of Kellys and I'm gonna go ahead and load them onto my vessel loops because ultimately we're gonna end up tagging them with something. So I'm just gonna go ahead and have them loaded, ready to go. Okay.
And then save your little skeeters to put your suture booties on. Your little
guys.
put a slope like that. She'll show you. She showed you.
I show you.
Yep, help with 4x4s for the dressing. If the surgeon wants some sort of patch, there's like various ones and made out of felt.
So the suture booties just go onto the tips of your mosquitoes, okay? So you will literally put one in one side, one in the other. Put it on the table, it's probably easier. One word. So you just put them right on the tips. Okay?
Will those usually come in vascular stuff, or is that something that we need to grab, put on our?
It's usually a peel pack.
It's, yeah, usually separate.
A disposable item.
Okay, so,
And they usually come with like 10. It's like a long thing, like the size of the little Kittner thing. And there's like 2, 4, 6, 8, 10.
And I just
But
cut them.
we
for
cut
our
them so
purposes.
that we could each have.
So we could all use them.
mhm. 4.
Make sure you sign in and put your time when you got here.
Okay. Actually, I'll put that last. Suction.
Are you gonna want some medication?
Yes, please. Are you ready to give them? I know you're trying to go see the patient.
I'm at your beck and call.
Okay, you're my back and call girl.
Yep.
Woo!
That's me.
It'll be a fun day. All right, my dear. What do we have first?
How about some normal saline?
I'll take it. I'll take some knackle. Sorry, I don't want to use all these.
Lots of drugs, lots of drugs. Got a lineup. Okay.
Knackle.
Oh, here, look, I guess you want to see the label. 0.9% sodium chloride. I don't know, good stuff, 1,000 mLs.
Stars 421. I'm ready.
Somebody step on your toe?
Yeah, maybe. Might help.
Yeah,
Look
make
at
sure
this
you-
action right here.
Make sure you label it after you put it back in the circulator.
What?
I could hear some whispers going on.
Come on, shout it out. Call
Yeah,
us out.
call
Come
us
on,
out
don't
on
be
our
afraid.
mistake. All right, what else you got?
Okay, I got some lidocaine. This is gonna be for the local anesthetic. So
Okay.
this is lidocaine 2% with epinephrine,
2% lift.
1 to 200,000. Plus 1,
1 to
200,000. Expiration date 8/22, my birthday.
hey. 2% lighter with epi. 200.
Would you like to see
I would again. I saw it, but I will double check it. Thank you. we know you're a vampire. I've been into the Vampire Diaries lately.
So this one's gonna get, this is the lidocaine, so it's gonna get loaded in your 10 ml syringe, or a 12, whatever it is.
I think that's what I need is like to write down what goes in what, you know, like what medication is in the 10, what medication is in, you know.
Okay,
Okay, so next I'm going to give you, heparin and saline. IV
Heparinized
saline. So
saline.
this is gonna be 0.9% IV saline for injection. And expiration date is 1/2022. And how many mLs is this? 20 mLs.
CC, 20.
Okay.
So on your label, do you write IV? Saline, just so we can
Injectable,
know, just so we know.
INJ.
Wait, the O is becoming an H. Okay. Yeah, I'm gonna give you 10, so that should
Oh, you're
be
giving me
enough.
10?
No, well, I'm gonna give you this, but I'm
20.
just talking about what bucket you're gonna put
And
in.
then you're giving me heparin for how much?
Can I pour this first?
I wrecked them.
You can do 2 labels. Okay, and then this will be your heparin, 10 mLs of heparin, and that is 10,000 units per 10 mLs. Expires 08/22.
21. We're gonna use it before it
Okay, you're gonna use
expires.
21, okay. I just did
1,000 per?
10,000.
10,000 units per 10 mL.
Expire 22, 21, maybe 21. Okay.
Come on. Come on, baby. Oh! Oops. Okay, thank you.
Oopsies.
I throw your ratio off a little bit.
A little bit, we'll just pretend I've been.
I don't see nothing.
Okay, so what did we just combine?
Okay, so that's hep saline. That's gonna be your heparin and your saline. That's gonna get loaded in your 20 ml syringe.
Okay,
And your ratio is gonna be depending on what the surgeon wants it to be.
okay.
You might have to put in 2 different cups and then mix it.
Yes.
A lot of times you'll use like a blue bucket and they're gonna give you like 250 or 500 mLs of IV saline. Then they'll add the heparin to it. So this is just, it's gonna be more than this, all right? Because they're gonna flush the vessel with
Right.
it. And you're gonna put your angiocath on that one.
Yeah, so they sometimes, it used to look like they use a decanter and then it'll actually come in like a hanging IV bag and then
Yeah.
they decant it.
I'm gonna show them a decanter. I grabbed a
We have
couple.
okay. Oh, we've got a box of them.
Okay, so see the angiocath one on there, it's just the catheter, not the needle part. So take the little IV catheter off and hook it on there. Now, a lot of times you'll have, in the field, you probably, instead of an angiocath, might have a heparin needle. And a heparin needle is like a little metal, it's not sharp on the end, it has like a little tiny bulby on the end, and it's about that long. So you might see that, a heparin needle.
And it'll be on the tray usually.
You want me to grab one?
There's usually a
Yeah,
straight one and
there
an
should be
angled
some
one.
bags in the med cabinet.
Okay.
Okay, so next I'm gonna give you some thrombin. Now thrombin, do we have gel foam? Oh, I think this is
That's a
supposed to be your
foam.
gel foam.
Mhm.
Okay, so I'm gonna give you, thrombin is the liquid part, and usually the nurse has to reconstitute it, but you don't have to do that here. And then one of these little white guys are gonna be the gel foam. So you're gonna cut them up about, it depends on the surgeon, half-inch squares, inch squares, whatever. We can just do half-inch here, I guess. Okay, so I have thrombin, 20,000 units, and this is 10 mLs, and it expires 8/21. Thank you. Here, you look today?
I think this has got I'm assuming
Okay,
this is just to plug it.
Okay. See how I am at pouring this up. I did pretty good with the other ones, but no.
Makes a difference.
Okay, so here's your thrombin, that's, your gel foam that's gonna get soaked in there. And you can just pop that up at the beginning or open it. One last thing, when you're done with that,
What's it gonna be?
this is gonna be papaverin.
Papaverin. Papaverin.
Are you being timed on this also?
Yes.
Papaverin. I don't wanna waste these, let me cut them. You know, OCD. Where our OCD kicks in.
Who remembers what papaverin does?
Slows the heart rate.
Good guess. It's definitely something vascular.
Does it reverse the effects of heparin?
No, but that's a good guess. No, they're gonna inject it into the wall of the artery. Why do you think? What happens when you start monkeying around with a vessel? What does it do?
They get kicked off and constrict, and so
Yes!
the papaverin is gonna actually vasodilate, right?
It's gonna
Okay.
relax the vessel
Relax
up.
it, okay.
Okay, and usually they'll just drop a teeny bit of this. So we have a TB syringe. I don't know if all of them are pour tops. Some you might be drawing up depending on where you are. Anyways, without further ado, this is 10 mLs of papaverin, 30 milligrams per ml.
Okay.
30 milligrams per ml. You wrote that right?
No.
10, 20.
Hold on. 10 mLs, sorry, 20, let me look.
30 milligrams per ml. And I'm gonna give you 10 mLs, and it expires 10 of 23.
10, 20.
Okay. Okay, that's it.
Okay, so it's got our,
So everything's labeled, everything's in its own place, in its own cup.
so we've got our NaCl, we've got our local, we've got our injectable saline that gets mixed with the heparin in the 20 ml. And then we've got our thrombin.
Just stays in the cup and you soak your gel foam in it. So you can just literally cut it up and just shove your gel foam in there. So that, what does gel foam and thrombin do?
Coagulate.
Coagulant, right. So after they do their, they sew up their arteriotomy, they're gonna want some gel foam and thrombin. They're just gonna give them a forceps and just hold up your bucket and they can grab out, put it on there, maybe a little sponge, hold a little pressure. And then they're gonna check the suture line afterwards,
Okay.
after they've given it a spell. Alright? So, you should have a 15 blade and an 11 blade, correct?
Mhm.
Correct?
Okay, so 15 blade's gonna be for the skin, and then your 11 blade's gonna be for what?
Arteriotomy.
Yes, the arteriotomy. Usually they nick the to make the arteriotomy, and then they're gonna extend it with a special scissor. Anybody
Pops,
remember? Yes, the pops. Alright. What else? Your head saline's gonna be used to flush, so keep it up there. We have our lidocaine for the local. Papaverin's gonna come before the arteriotomy, right? Because they wanna help the vessel not be so snarkified. Let's see, what else? Vessel loops, are there. Clip applier if they want to, clip some vessels. We don't have any ties on here, do we?
I don't have any silks.
Do we want ties?
Not a bad idea.
A lot of times they'll have like some silk ties, like 4-0 silk ties, if they wanna like ligate the vessel, or they can clip it and cut it, whatever, surgeon's preference. Let's see what else. Yeah, so they're basically just gonna dissect down the beginning, and the real world is gonna be kinda slow, because they're just dissecting down to the level of the carotid artery, and so as they find vessels, they're little bitties, they'll probably cauterize them, clip them, ligate them, whatever. If they're bigger tributaries, they're gonna wanna put a vessel loop around them. I usually dunk them in saline before I pass them, just so that they slide along the tissue a little bit better. So then once they get ready, they're gonna put their clamps on the carotid. You have a couple, I think there's some angled DeBakey's in some sets, some curved Satinskis in others, but you'll pass your vascular clamps. In the real world, they usually use 3. We might only have 2, anyways, to clamp. And then as soon as the vessel is clamped, it is go time. You wanna be on your game, because as long as they're clamped off, no blood's getting to the brain. Some surgeons will use a little bypass route. What's that called? The job is shunt. It's like a straw, but it's bendy, flexible. They'll put above and below, so that blood can still use that as a bypass route. But some surgeons don't. All right, so when they're clamped off, we want to be working very efficiently and effectively to facilitate so that we can get in and get out. So once they make your arteriotomy, they're gonna clean the junk out, right? Like that's why we're here in the first place. So freer elevator, I think some of these have a little pin-filled elevator and a fine forceps. They're gonna clean out the junk. That is gonna be your specimen, okay? Once they get the junk cleaned out and that is passed off, they'll probably do some irrigating with hep saline. They might do that intermittently throughout. Get ready for the closure of the arteriotomy. Right? Sometimes they might want a patch or a graft if they do whatever. It's there, you can get that intraoperatively. Once it's closed, then some gel foam thrombin. Wait a minute or 2, make sure that it's not bleeding. You want to keep any remnants of your ProLink. So the blue stitch that is double-ended, it has 2 needles on it. That's what you're going to use to close the arteriotomy. That's going to be the first closing stitch. Initiate your count once things the surgeon settled it. If any remnants of that come back to you, keep it handy, because if they take the gel foam off and there's like a right? They can use that as a little stick tie. What else was I gonna say? There was something else. Can you lift up your towel so I can see your stuff again? Maybe that'll remind me. No, it's not reminding me. What was I gonna say? It was something about, oh, so when they go to tie the Proline stitch, have your hep saline ready, squirt your surgeon's hand. That way it's going to make the Proline slide through the surgeon's hand against the glove easier, because this is a very, very fine suture and it can just snap like a hair. Alright, so they'll usually want some hep saline on there, and the surgeon I used to work with a lot, he would get his first loop of his knot and then he would just put his hands like this, and I knew to do the thing and away he would go, right? Yeah, so then, for declosure, we have the Vicryl, and then I think we have nylon for split. Okay.
Does everybody remember the hand screw?
The way?
Does everybody remember the hand scrub? What about loading the Castro Viejo? Can you speak to that? Do you guys remember
That's
loading
right.
this? Okay.
Yes, a little.
Hold it like a pencil, right, when the surgeon uses it.
So it clicks into place, and then you just make sure you have a good little bite. And click it right up.
For me, you'll have to flip it after you load.
For her, it's gonna be just the opposite.
And then you pass like a pencil pass.
Yeah, little picture of it. That's when I discovered how bad my eyes were.
All right,
I
can you
like
show them this
loading it and
forceps
having
in
it
here? I'm
ready.
sorry.
Nope, you're good.
So this is a Gerald forceps. This is usually what they'll use once they get ready to start working with the vessel. They'll want to, or as they continue their dissection deeper, they'll want to switch from DeBakey to this Gerald's. All right. In a couple of the trays, there's a little bitty Can you show them the little bitty when you're done?
The bulldog.
We usually count them, I think. Want me to put it up there?
Is this what you want me to show them?
Yeah,
The
Talk
bulldog?
about that, okay, thanks. So it's just a little bitty clamp, right, and we usually count those.
How do you pass it?
Just like that.
Okay.
It's a little dainty
You got
thing.
two, right?
I think she only has one. Do you have one bulldog?
Yeah, I just have
Oh, I
one.
think we all
Okay,
do.
so these are
I
called
think we have
bulldogs.
one each in each tray.
You might see some too that come in your tray that look similar to that, but they have like little rubbers on the tips of them. We call those rubber shod bulldogs. And they're for putting on the suture. Okay, not the tissue. And usually what I would do is I put them along my towel on my mayo stand, but I mean,
I always clip them on I always will clip them on the needle protector.
Yeah.
wherever, so you can just kind of keep track of them, when you're in the real world. All right, and then the Jackson Pratt. So Jackson Pratt, they're gonna wanna put this in before you give them the 305 call. All right, so they're gonna take a little knife, make a little incision right below the wound, and then some sort of clamp to pass. A tonsil would probably be good. Gonna stick it through the hole, and then they're gonna pull the drain up through into the wound. Or I guess probably pull this end. They'll stick the clamp into the wound, they'll grab the round end, and they're gonna pull it out so that this part is gonna stay in the wound. Always have your suture scissor ready in the real world because they might want to trim it. Or if you get to know your surgeon well enough, you might know that they like 10 holes. And so you just prepare it and you always cut it at the 10th hole. I don't know.
Cause this one is not fully fluted. If they were fully fluted, it would be all the way down, the holes.
Yeah.
So yeah, you may cut off to about right there.
Yeah. Just don't ever decide that on your own, you know? Or if you work with one surgeon that always wants it a certain way, don't assume that another one, like that's standard across the board, just, draping's just gonna be 4 square, our regular draping, alright, with our lap sheet, we're just gonna drape here instead of here.
And typically in the world out there, you're gonna see a thyroid drape that'll typically be used for a carotid instead of a lap, because it's got like a triangle or a diamond, I guess, technically, that's just the right size for the neck.
A double-sided
A
triangle.
double triangle.
Exactly, if you open,
No, I get it, yeah,
if you
yeah.
were to open it.
Cut it open.
Yeah.
The other thing that I wanted to say is there are these, things called magnetic mats. And they're, ish big, they're disposable. And a lot of times the surgeons will want those for thyroids or, carotids or whatever. When you get draped and you get settled in, you just lay it up on the chest right here, and then the instruments will stick to it. Alright, so there might be some instruments that they kind of want to live there. You're gonna have to get to know your surgeon. But you're kind of working on this hill, right? So it helps,
Some hills are bigger than others.
reduce the chance of things going southward, onto the floor. But, yeah, so we might see that, but we dug around in that storage forever, swearing that we had them in.
I swear we do. I don't know what